Hi, this is Krista Rimmer, and this is day 2 of my Ball'z Palsy self-care. I have had Ball'z Palsy for 3 months, and this is my second day of actually doing my own self-care for myself. When I first got Ball'z Palsy, I did the prednisone, the steroid. That will help with the inflammation, which causes the nerves to swell and kind of shut down and make your face all, saggy. And I did do the doctor prescribed prednisone. This time around, I did have it in 2009 on this side. This time around, it was a lot more physically painful and a lot more mentally challenging than it was before. This time I had the neck pain, the jaw pain, the face like you were like boxed, and also I have not noticed as much improvement as I had before. After 2 or 3 weeks, I had noticed some improvement in my eye, and my eye didn't hang down as low. You could it was mostly even with the other one. It was just kind of looked like a glass eye because it wouldn't move or wouldn't blink, and it was kind of glossy. Now this one hangs a little bit below the iris, and it's glossy because I have drops in it. The point of these videos, there are lots of videos out there for Ball'z Palsy exercises, what causes Ball'z Palsy, what massages you can do on your face, those different things. There's lots of videos. My Fit Girl actually has the most extensive set of videos, and she's very inspiring. She did have a pretty severe case herself, and it lasted for over a year. This is mine, 3 months, and I'm a certified hypnotherapist. I have a lot of things that I would recommend for a client if they were to come, after, of course, they saw their doctor and did that routine. But if they were to come to me for the pain or for stress or whatever was going on with them, there's lots of things that I would offer or recommend to them, but for some reason I did not do them for myself. And I think in our society, this is a typical way we approach life and how we deal with other people, is that we are really quick to help others, but we are very slow taking care of ourselves. And that just doesn't work. It doesn't work. You must take care of yourself first. I'm not talking about like if your child's hurting or something like that, like a need. But when it comes to taking care of yourself mentally and physically, you're going to be able to do so much more for your child, your spouse, your boyfriend, your employer, wherever, at school, wherever it is that you're doing, you'll be much better value to that community if you're taking care of yourself first. And that means, it could just mean like a foot soak. It could mean like doing your nails, or it could be reading, whatever it is that relaxes you or takes care of you. It's very important that you do that, and we often lose sight of self-care. So these videos, haven't done anything for myself for 3 months. I did go to acupuncture. I did do that for a few times. I noticed slight improvement, but you really need to go to acupuncture at the very beginning, and you need to be consistent and keep doing it. What I'm doing for myself in this video is a series of videos every day, so you can see at home my improvement day by day by day of how I progress as I'm taking care of myself. So what I did, yesterday was my very first video. I did a 30-minute video, and it talked about what happened, what is Ball'z Palsy, physically and mentally, what was going on with me and this Ball'z Palsy. And you can see that half of my face is paralyzed, like this. You look really upset all the time. All the muscles, all the nerves shut down that hold all your muscles up. So your eyebrow, your eyelid, your nostril, your mouth, your cheek, all those are just bleh. So you got this whole dolly thing going on. You just look really upset all the time. And this is my other side. What I did for myself is I recorded a hypnotherapy audio, and it has myself speaking doing a head to toe relaxation first, then putting in some suggestions on healing and the nerves working together, firing together. You want the nerves to fire here, fire here, fire here, each nerve firing to the next nerve, and eventually all the nerves, you know, all that bundle of nerves that come from this one section, all of them firing again, so it pulls all your muscles up and makes you look less maniacal and less of this whole mad eye moody thing going on. So I listened to the hypnotherapy, and I actually listened to it twice, and this is the result on day 2 after 1 day of self-care. And mouth-wise, closed smile, it's very small for you guys looking, but there's a little tiny baby movement right here, and that little bit of movement eventually will pick up and it'll be enough to pull up my chipmunk cheek so that I can smile like a normal person, or smile like I used to. I'll never be normal. But this, so that's closed mouth or without teeth. It's so weird because you have to really make sure that you're working your nerves at the same time, that whatever you're feeling here, imagine that same feeling here and this picking up, because you don't want what can happen with these nerves coming back in and starting to fire again. You can actually train these nerves to do something totally different. So it's, I believe it's called synthesis, and if you don't do both sides of your mouth at the same time, there was one woman who would smile and her eye would shut because she wasn't doing, because she was only working the one side and working it a lot, and it retrained her nerve to shut her eye. So you don't want that. So just be really aware when you're doing the exercises that are all over YouTube that you're doing both sides. But this is my mouth. But there's movement, baby steps, and then nostrils. You can see it opens up a little bit, and then eye, not closing. And I'm really kind of concerned about that part because now it's able to do it without this eye. So I just have to make sure I do both eyes. Otherwise, I'll get this side doing something that this side's not doing. You want both sides to match. So be really cautious of those exercises. Eyebrows. This eyebrow doesn't go up as much. So the massages that are recommended would be to massage this up and just massage up, and that will help the nerves pulling the muscle up. And massaging, you know, your face to help pull your muscles up on that side. So that's what my status is on day 2. Little bit of improvement. So I'm going to continue working on my self-care and curing the Ball'z Palsy. And tone-wise, all that stuff is still the same, still paralyzed. So follow me along. I will do day 3 tomorrow, and I will be doing some stuff with essential oils and also doing the hypnotherapy as well. So take care, and I will see you on day 3.